Well, we're going to talk about myths and realities. In other countries, it will be called hot topics or controversial topics about rotator cuff repair, specific to the massive ones injuries. And I have no disclosure to report. Talking about shoulder and talking about the rotator cuff tears are a complex issue. There is a series of chain events that ensure optimal function, that we can raise our arm and use it for eating, for dressing, or even for cleaning. But there are two main components, as we see in the other sessions. We have bone tissue and we have soft tissues, which is the most complex tissue around our body. This is a classical patient that came to our different offices with a massive rotator cuff. We don't discuss about the definition of massive rotator cuff. This is our patients with tendon retraction, very important, and massive infiltration, fatty infiltration around it. And most of the times we go to the OR and perform surgery, most of the time arthroscopic surgery that all of us used to perform using different types of anchors, sutures, tapes, many instruments, and we are almost the time happy with our surgery, like we see in the past session. And for some reasons, some of the patients needs post-operative MRI. So this is a 3-month control of the MRI, and I can see the tendon here. This is where the anchor is, and this is another vision. But this is the imaging of this. The good news is that the patient is pain-free. She starts moving and an active forward elevation of 90 degrees, and the patient is happy. But maybe we should discuss what are we looking in this 3-month postoperative MRI. There are many articles in the literature with different types of classification, different types of algorithms, or way we can treat this since conservative treatment, and different configurations of sutures or configuration of anchors, and many ways that we can free our tendons in order to get it to the bone and repair. But as we heard before, the anatomy is really complex, specifically for the supraspinatus and the infraspinatus. There is no easy anatomy. And if we can add more complex to the anatomy of the rotator cuff, we have some images about the superior capsule, the real superior capsule at the shoulder, and the tendon of the supraspinatus. And this is have a new direction on types of surgery. That's why the superior capsule reconstruction emerged and have some success on the description of many techniques. And we as surgeons, if we have this type of injuries and a complete or a massive rotator cuff tear, well, as surgeons, everything can be fixed. And we can get together the soft tissue, different configurations, different types of sutures, and many anchors. After that, we can close the gap. But closing the gap is not what we really need. We need a perfect or anatomic repair and a transformation of that repair in a normal or regular rotator cuff. That's why I had this talk about myths and realities. Healing and recover the proper function is something different to what we saw and how to approach soft tissue and how to get it to the bone. It is really a complex procedure, and it works in function about tendon retraction and fatty infiltration. I know there are 3 papers in the literature that say that fatty infiltration can be reversed, but there are many other papers that say that fat infiltration is something irreversible. So we can discuss about it, and biologics, orthobiologics is working really hard trying to get this reversed. But now at this moment, we don't have any successful tool to reverse fat infiltration. And if we had fat infiltration in our muscles, it is really difficult to get it back to normal work. So, what are, to my consideration, the myths about the repair of the massive rotator cuffs? Myth number one, arthroscopic surgery is the best treatment. In Latin America, this is a really, really hot topic. We have two ways of training. The first way of training is people who perform arthroscopy surgery to get trained in Europe, get trained in the United States, and came back and said everything is repairable through arthroscopic surgery. Well, there is another kind of surgeons, but we perform shoulder surgery, and we have open procedures and different ways of doing this. All the massive rotator cuff can heal. Well, if healing is not having pain, recover motion, okay, all injuries can heal. But if we're talking about real healing, transforming the tissues that we put to bone into a fibrocartilage healing tissue, that's something different. We can have ultrasound guided studies, MRIs, and we cannot reproduce the regular or the normal footprint of the rotator cuff. Although injuries can be repaired, yes, as we said before, we are surgeons and there's nothing impossible for us to get the tissue back. But we have to ask if that tissue is real tendon, if that tendon is real with the abilities to heal. I led you in the table. There is less pain with arthroscopic surgery. Well, I can assure you that both arthroscopic and open surgery can produce a lot of pain, and as well can produce a painless free surgery. Right now, in Mexico, in my country, most of the patients didn't like shoulder surgery because of the pain. After total knee replacements, shoulder surgery is the most painful surgery right now. I don't have the right explanation why occurs this, but this is what happened right now. Rehabilitation is easier with a scope. Well, you should try some open surgeries and see how easy is the rehabilitation. The most important complication in arthroscopic surgery is deltoid injury. I can see in my clinic many sequelae of shoulder arthroscopic surgery, which is the deltoid detachment because of liberation, because of acromioplasty. The subacromial balloon and the superior capsule reconstruction are efficient alternatives. This is completely put at a discussion. Well, if we're trying to see very, very short-term results, maybe it works. But if we're trying to medium and long-term results, 5 to 10 years, there is not enough evidence that these new techniques, very exciting techniques, very challenging techniques, really work as a supplement for a rotator cuff repair. And finally, orthobiologics will save us. Well, it was wonderful since the last 12 years we have started hearing about PRP, stem cells, different types of cells, different perforations, different types of treatment, mesh, different biologic tissues, but at the moment we don't have that perfect orthobiologic solution to get 100% healing in rotator cuff repair. Well, I have to show the conservative treatment. It's very important, at least at my clinic. 60% of my patients ask for this type of treatment because they don't like surgery, they don't want surgery, and they cannot pay the surgery. So I already have a 70% satisfaction with conservative treatment. It's a different stage, different goals, and different methods for this rehabilitation type of treatment, but it works. It really works. And what it works? The treatment works if we get 100% degrees of forward flexion, 20 degrees of external rotation, internal rotation to L5, 50 degrees of abduction, and pain-free. That's the goal for our patients, and the patient is really happy with this type of treatment. They don't want to throw things. They like to get dressed, they like to get food, and they got to get clean. So this is my definition of satisfaction. Well, as surgeons, we have developed different types of configurations of repair around the tendons of the rotator cuff. But the healing is the most important thing that we have to observe. If we do some interval sliding liberations, we have a range of healing of about 50 to 91%. If we do margin convergence of the tendons, 47% of healing. What happened? If the patient is pain-free, is happy, no matter if it is healed or not. In general, we have to remember, we are living longer. So the kind of healing of this tendon decreases with age. It is right now impossible to revert this. So if we operate patients more than 60 years old, the chance that our surgery function about healing is 43%. And the time in between healing and rehabilitation period, it's really important to talk with your patient. When I speak to my patients and said, your time of rehabilitation is between 6 or 12 months, they said, I cannot afford that time of rehabilitation. But that's the real thing. Our patients need longer time to recover for these types of surgeries or these types of diseases. So, again, what are we going to do with these massive rotator cuff tears? Well, what are the realities about this? Well, arthroscopic surgery has allowed us to develop many instruments and implants. There is a lot of companies, and you can see on the show outside this room, there are different anchors, different tapes, different sutures, different procedures, different everything. We have better outcomes than 20 years ago? My assumption is yes. We are understanding better the biomechanics of the shoulder. We are understanding better the way we can move our patients into rehabilitation, into working with the deltoid, so we are better. Tendon healing is decreasing after the age of 65. That's a reality. We cannot revert this until now. Orthobiologics is a good part of medicine. It's a really interesting part of medicine, but it still do not find efficient, safe, and reproducible response. There is no product that I can use on my patients and reduce the healing rate 50% of the time. The healing rate is the same. We can talk about different cells, different products, different whatever, but we can get the healing response. And be careful, non-traumatic injuries, the best and the first option for me is a conservative treatment. And remember, all of us as surgeons have the best results in the first 6 to 12 months of postoperative surgery. Time, like we heard before, time will settle the things about the results of our different techniques, different implants, and different configurations. The type of repair, we have evolved from the double row to the double layer, different implants, different sutures, different materials. Even we have, like we see here in the pictures, a special suture tape that can shrink during time, so keep the tension in the repair. It is called Dynacord. It's not all over the world right now, but there are many improvements in technology. But we have this, what the authors call the hamburger patch. They combine an extracellular matrix patch, rotator cuff, and the long head of the biceps, all in these constructs to get the healing. We are not at that point yet, but we have to see this. Augmentation, this is our contribution to the shoulder surgery. We use a synthetic pad of polyethylene that show good results, 90% of healing at 12 months and 70% of healing at 5 years of follow-up of these patients. But what happened, it's not biologic. That company get absorbed by another bigger company, and you don't have this type of patch. Maybe for the next years, we'll see again. Different articles, different times, countries, they are working hard to get the solution. And remember, there's another issue with the massive rotator cuff tears. It's the previous stage to the rotator cuff arthropathy. It's not a new concept, but it is really new for many arthroscopy surgeons. They're trying to repair massive tears in patients with cuff tear arthropathy. And that's why we have many bad results. Rotator cuff arthropathy is a very complex problem. It is the last part of the massive rotator cuff tear, and the best solution for this is a reverse prosthesis. I leave you on the table, and we can discuss many things about it. So take-home messages. Analyze first the repairability of your repairs. Identify signs of massive rotator cuff arthropathy. Do not forget the long portion of the bicep as a source of pain in our patients. Can we have another minute, please? It's just for the finish. Consider the adhesive capsulitis as a factor of pain and disability of these injuries. The massive rotator cuff at 6 or 12 months, it is most of the time with adhesive capsulitis. So you can take on count. It doesn't need to get surgery. We can discuss about it. But most of the time, mobilization under anesthesia for this type of patients can relieve the pain and allows a very conservative treatment and get success. Known all the therapeutic options, arthroscopy is the best tool that we have for repair this, but there are another tools that we can be aware in order to get success in this type of patient. Remember, massive rotator cuff repairs and injuries are really, really unpredictable. Each patient has to be personalized. So this is Latin America. Thank you for your attention, and we have a good discussion.